Hi, welcome to another edition of Pauline Interviews. I'm here at New Renaissance Bookstore in the Event Center, and I want to thank them for letting me use this space. It's great. They also have lectures here in their bookstore. It's called New Renaissance Bookstore. It's on Northwest 23rd. They have wonderful people come and do lectures, workshops. In the store themselves, they have crystals, they have books, anything metaphysical, alternative healing. So stop by sometime and say hi and come and see what they've got. But right now, I want to get to my topic. And my guest is Dr. Maggie Yu. Thank you for joining me. And Dr. Maggie, which I'm going to call you, has a great story. I mean, sometimes something bad happens to people, but it turns around and becomes something good. So without stealing too much of your thunder, I want to introduce this as a topic. The topic's autoimmune disease. And you are a medical doctor, but what happened for you to kind of switch your focus from medical doctor to functional intuitive medical doctor?
Yeah.
And what is a functional intuitive medical doctor first?
Okay. So I love this. This is my passion. And what I currently do is we have an online medical program. It's a medical coaching program called Transform Autoimmune Disease Naturally. And what I found was that I've been a clinician for 22 years, directly one-on-one patient care. But what I found was that there were so many limitations of that, and my ability to actually provide a whole picture outcome for people, a training and an outcome for people for something as complicated with autoimmune disease was impossible in the clinical setting. And as we talk about it more, you'll understand more why. But that's why we have our entire program online. It can be done by anyone in the United States, in the UK, Australia, and Canada. And people visit drmaggieyu.com and they can learn more about it. Now, why did this come about was my own calamity. Honestly, was about 12 years into being a practicing family physician, right in old Sherwood, Newburgh, Oregon, where you are from. I came down, I didn't know what I came down with. I knew that I was having severe symptoms of fatigue, joint pain, depression, weight gain, hair loss, and early menopause.
And you were
at the age of 36.
That's so early. That's at least 10 or more years young.
Typical, actually, in many autoimmune diseases is for women and men to have horribly screwed up hormones. And I didn't realize it at the time. None of medical school training prepared me for that. And in fact, I was one of the 30-ish, late 30-ish, 40-ish year old women that come in with all these complaints that I didn't know what to do with. I became my own worst nightmare patient, because I didn't know what to do. And I had all these symptoms, and all the doctors kept telling me everything's normal, everything's normal. I had to finally beg, because this is literally the fight of my life, for finally different doctors, naturopaths, and I finally had to beg for autoimmune testing.
How would they say it's normal when you're losing your hair?
Well, their labs are normal.
Oh, the labs. Okay.
Well, the labs are normal.
What are they testing? Your blood?
They're checking my blood for thyroid, checking my blood. They wouldn't even check my hormones. I had no periods for like a year, and I was gaining weight like crazy. They wouldn't even check my hormones.
Well, I'm not a doctor, but I would think,
They don't know how, Pauline.
Oh.
So here's the thing is, a lot of people make the mistake thinking that doctors know the answers about something as complicated as autoimmune disease. There's literally like almost zero training in autoimmune disease in the conventional medical community.
Hasn't this exploded in the last couple of decades?
It's crazy it exploded because the triggers for autoimmunity, for triggering the onset of autoimmune disease, has gone up through the roof. And meanwhile, testing for autoimmune disease is still really limited. In my experience, less than 2 to 3% of autoimmune disease can be diagnosed through a blood test. The other, 98,000 other targets of autoimmune attack, we don't even have blood tests for. So there's a lot of people like you, people in your family that are walking around with mystery illness symptoms that could never even possibly get diagnosed right now. They're actually running around with autoimmune disease. And the awareness of that is really just starting to happen now, which is why our program is exploding like crazy, because there's tons of us, women and men and children, walking around with mystery illnesses that people don't realize are autoimmune. And those are, I guess, the lucky ones, but then there's unlucky ones, I guess, that already have the diagnosis, like people in your family have Crohn's, possible Hashimoto's, right? And I fought to finally get myself diagnosed with Hashimoto's, and that's when I realized, oh, now that I have the diagnosis, guess what? There's nothing they can do about it.
What is Hashimoto's?
That's an autoimmune attack against your thyroid, which is a hormone-making organ. But what people don't realize is your thyroid is a hormone-making organ. Autoimmune disease is your own body, your own immune system attacking itself.
That's right. That's what I was going to ask you. That's what autoimmune is. It attacks your body.
Your own immune system mistakes your own body as a germ and is actively trying to kill it. Now, if it already mistakes one part of your body, let's say your thyroid as a germ, what do you think is the likelihood it's going to mistake your ovaries as a germ, your adrenals as a germ, your joints as a germ, or your gut as a germ? 100%.
It's attacking you constantly all over.
So we have people with this whole rap sheet of mystery symptoms, and it's really one autoimmune attack in process. And what I recognized in myself was that there's a lot of layers of it. There's the medical component of it that doctors don't know what to do with. They only can offer you medicine or procedures. There's the alternative medicine side of it, where there's a lot of herbs, supplements, hormone testing, and all those pieces. That's important in my own turnaround. But there's a third magical piece, which is spiritual alignment.
Now that's
mindset.
Wow.
And what I discovered in myself, and what I do now helping thousands of people with autoimmune disease, is that there's literally a certain pattern of thinking that triggers and feed autoimmune disease, so you don't and you can't get better.
That I would never have gotten. The one thing, and I want you to go back to that, don't forget that, we're going to talk about that, but the one thing I wanted to ask you was, why are we seeing so much autoimmune disease now? I mean, that's one of the contributing factors, but isn't it all the toxins and the...
Yes, all of those pieces. So there's a genetic predisposition. So autoimmune disease don't exist without genetics. So if one person in your family has autoimmune disease, I'm betting you almost everybody in the family has autoimmune diseases, whether they know it or not. And so there's a genetic predisposition, but then there's environmental triggers. So a huge environmental trigger that we work with is food. So the food that we eat right now the amounts of certain foods we eat is so high that the trigger, even if it was small before, is incredibly high. So just an example is the bread that we eat now, the wheat that we grow now is all GMO'd, so they contain 7 to 11 times more gluten than the bread that was made in the 1910s and 1920s. So gluten is a very irritating molecule to the immune system.
Besides GMOs, we don't know what they do to the body.
Well,
they're not natural.
But we GMO'd wheat to have 10 times more gluten, to have 10 times more shelf life. So that's when Wonder Bread came along. And so you could see us eating the same bread. It looks like the same bread, tastes like the same bread, but has 11 times more gluten. And that molecule is just particularly irritating to the immune system. It's just another trigger. So one slice of bread now has 7 times more gluten than it did 50 years ago. And you wonder why people have more autoimmune diseases, because certain foods can trigger the autoimmune attack. What we do is we use testing to figure out exactly with data, what foods is triggering the autoimmune attack in you. I was just having a conversation with your sister about having a family member with Crohn's. So many people are guessing with elimination diet. And for me, it's really important to actually have data. And that's the medical side of this I love, is to say, here are your hormones. Here's your food testing. Here's the data. And then we teach people, what does it mean? What do you do with that data, right? And then you add in these other layers, which is what are the lifestyle things that are happening going on? And more importantly, what are the spiritual mindset patterns that are happening that's reinforcing autoimmune disease to stay?
What's the lifestyle ones? And then we want to get to the spiritual.
Many. So like what I found is that one lifestyle thing is huge is that people with autoimmune disease have typically, probably at least 80% of them have what I call pleaser personalities.
Oh, yeah.
Which is they please everybody else and they put themselves last. Therefore, they're actually feeding the autoimmune attack against itself because they're not prioritizing their own self-care. So typically in the population of autoimmune disease, self-care is last. So a lot of this lifestyle changes we're talking about is having people have awareness of how truly spiritually, emotionally bankrupt they're really at, and that they can't actually get their immune system to work for them when they're not even home to defend the turf.
Were you a pleaser? Were you a caregiver?
Hell yes. Hell yes.
Yeah.
So something really important for people to know is we teach. Someone's a good teacher because they're teaching from the greatest areas of suffering and lessons in their own life. So I learned this by being the ultimate pleaser in my life. And what I learned in my own story was when all this happened and was building and building, it was decades of pleasing and pleasing and pleasing and putting myself at the bottom of the totem pole so that there was a war inside my body and I was absolutely unprepared to defend myself because I wasn't even at home. I was busy pleasing everybody else. Do you see that?
Yeah, I see that. And also being a doctor too, you actually, you put your whole immunity to the test because you're studying hard. You're working so hard. You're stressed out too. That's another factor, isn't it, the stress?
Well, we tend to be caretakers. People in caretaking professions have a very high rate of autoimmune disease because of that pleasing. So you'll see doctors, you'll see attorneys, you'll see people in the service industry, you'll see massage therapists, you'll see acupuncturists. A lot of people in service industries are pleasers, and so that literally self-care, that emotional self-bankruptcy, is what prevents them from actually reacting to disease properly.
Yeah, but I can see you being a pleaser, but still also doing self-care. Like, I can see you still, no, I mean, you could
The prioritization of pleasers for self-care is very low.
Okay, I was going to say, because I could see that, like, I please myself, I mean, a lot, but I like to please other people too, but I can see myself, I don't put myself last on the totem pole. I don't see myself doing that.
Well, that's why maybe you don't have an autoimmune disease.
Yeah, maybe.
But I'm specifically talking about in this autoimmune disease population, which is exploding huge.
I watch what I eat too. I'm really careful.
Exactly. What you see is that rate of self-care is very, very low in that population. There's a lot of guilt and shame with self-care actually in that particular population.
Wow. Yeah. Besides food, what is the other toxins that are in the environment?
Well, there's tons of toxins with, even in the food there's pesticide. And then, in the cleaning products at home that you have, there's tons of, use of chloride, bleach, EMFs from all your electrical devices. Even your heating pads have EMFs. So there's tons of environmental exposures that we're having now that we didn't have 50 years ago. So there was actually a study that was done in U.S. Army blood samples from the 1940s and now. They had frozen samples, and they found that the amount of autoimmune attack in the blood in the 1940s compared to now was literally 10%, like there was a 7-fold increase in the samples in 2000 versus the samples in 1940s. So it's not because we're diagnosing better, it's actually because literally the amount of attack back then versus now is very different, because we're getting huge amounts of environmental triggers as well.
What about immunizations? I mean, when I was a kid, I got...
It's a trigger.
So I mean, they're giving children so many more immunizations.
Yeah.
They're on TV scaring people about getting, what is it that now? It's...
all the vaccines,
all these vaccines.
That's a huge topic of debate right now for the Oregon legislature and around the country, around mandated vaccines, requirements.
There's more autoimmune.
Well, what you find is there's certain populations that are susceptible to immune irritation. So if you have an autoimmune disease, which is your immune system is, instead of working with you to fight germs, it's actually trying to kill yourself. And then there's food triggers, environmental triggers.
There's so many.
And vaccines would fall into what I call infectious triggers. So
then,
they're basically kind of triggering your own immune response against an infection to make you immune to it. But the job of vaccine is to hyper-trigger your immunity. So then, can it actually trigger an onset or worsening of an autoimmune disease? In my experience, yes.
Yes, but besides triggering it, because of that, it also is contained, all these toxins are in it, aluminum, mercury.
The mercury in it,
formaldehyde. I mean,
it's the chemicals in it. But it's not that vaccines are necessarily bad. I am not against vaccines.
Well, as long as they don't have poisons in them.
Well, that's important. Number one is make sure the preservatives aren't toxic. Number two is, and there's many vaccines that are preservative-free now. And then number two is that there is a sensible approach to vaccination where you can delay certain vaccinations.
Yes, exactly.
The current schedule and how it is, a lot of it is based on convenience for the doctor's offices.
Also it helps feed the pharmaceutical.
Well, there are certain vaccines that there's no reason it has to be given to a baby at birth. That could be done much later.
Absolutely.
So it's not, I'm not saying vaccines are bad.
No, we're just saying
but
the way they're doing
timely
them
way of doing it.
and taking the toxins out of them.
And removing toxins from them and preservatives from them is what makes the most sense.
Yeah, so there's so many things that are, because children are having so much problem with it.
And that's why for me, I love working with families. So what I tell people is, even though we work with one member of the family, it's a small group coaching program. I say every person that's in our program working with us affect minimum 3 generations in their family.
Wow.
Because I can tell you, we might be seeing the woman with Hashimoto's, but I can tell you her kids are an autoimmune mess already with tons of symptoms of like gut stuff, allergies, eczema, behavioral issues, ADD. All these are actually just targets of autoimmune attack in children that we don't recognize are autoimmune. And then you look at this woman's parents, and they've been dealing with irritable bowel syndrome their whole lives, or depression, or joint pain, or diabetes. Guess what? It's autoimmune.
You know what makes it sadder is the kids that have the attention deficit and the people that they're giving them drugs.
As a first option.
Yes.
As the first option.
The things that they're trying to treat them is causing more problems.
It can, but I'm a medical doctor, I'm an MD. I'm not against medications.
No.
I'm against medications as the first or only option.
Yeah, that's what you found. That's what you went through. That was the first.
Well, they didn't even tell me that there was possible drug. Well, they offered me antidepressants and birth control pills, which made me fatter, sicker, meaner.
God.
Okay. And I was like, I mean, it literally costed me my job, how sick I was, and the mood and the brain fog. It costed me my job. It costed me my marriage. You know, and so this is
Did
not.
you have children?
Yes. These are not small deals. The
Yeah.
impact of these symptoms are huge. And yet we tell them, oh, your only option is birth control pills or antidepressant. Made me worse. I literally was knocking on the door of the conventional medical community, which I was a part of, and there were no solutions. So I literally had to say, you know what, I'm going to go learn all about all the alternative ways of dealing with this. And that's what I did. I went on a 2-year path to really learn what I could. Functional medicine didn't even exist at that time. So I literally had to find my own way to figure it out. And I came up with what are the 5 things that really stop feeding autoimmune attack. And that's what we teach people to do is what are the 5 ginormous categories of triggers of autoimmunity? What's the data that you need? Get the training that you need to understand the cause and effect. And work on the spiritual, mental health alignment to make sure it sticks. Because for me, if you do not like actually align where your brain, what your thoughts are, your heart with where your spirituality and emotional state is, along with your body, if you don't have alignment there, you'll never turn around your autoimmune disease. That's what I found. And that's why for me, this is genie in a bottle.
How did you get I can understand where you, because you're a medical doctor, and I can understand you went through all this terrible thing, which turned out to be a fortuitous, because you're helping people now. So I don't know how you feel about it. I'd hate to have gone through it, but it would make me happy to know that it brought me to this place in my life. So I understand how you came there, but how you're helping people with the training, but how did you come to the spiritual alignment part? How did that, were you always a spiritual person, or did?
Yeah, like for me, what I found was that I can work as hard as I want on the medical side of it and on the education side of it, doing things that were very tasky. But the results were not sustainable in myself or in the patients or clients I worked with. Why? Because there was a lack of spiritual alignment. So,
which means?
Spiritual alignment really means that you have awareness of what are the destructive thoughts in you that's actually feeding this process.
Could you give me an example?
Well, yeah. So, for example, one of the things that I would say the pleasing personality is really interesting, but I would say the #1 most destructive spiritual thoughts that's affecting your being that affects autoimmune disease is lack of forgiveness.
Really?
That is a huge spiritual warfare in people. Both. Okay,
yourself and others.
Yes. So if you have trouble forgiving yourself, you can't forgive others either.
So what were you not forgiving in your life?
For me, there was a huge story growing up of a lack of forgiveness. I grew up with a judgmental parent, and there was a lack of forgiveness for not being perfect.
Oh.
Right? So, or, you know, if you didn't get the desired outcome, there must be something wrong with you. Therefore, you better really work hard on figuring that out. And therefore, I mean, and not everything causation is from you, but as a young child, if that's how you're raised, and many of us were, you take the blame for everything. I must have done something wrong. What did I do wrong? And you beat yourself up. Think about that term, beating yourself up. What do you think autoimmune disease is?
Beat you up.
Beating yourself up with your own immune system. So that is the language choice, the thoughts that is behind that, the language that you speak. Like words are either a blessing or a curse. Did you see how? Did you hear what I just said? Beating myself up is a curse against yourself. What do you think people with autoimmune disease do? Like spiritually, their internal warfare with themselves, not forgiving themselves. They don't forgive others. The language and words they manifest, it shows lack of forgiveness towards self and others. And as a result, physically they manifest a lack of forgiveness towards their own body.
What's another one? Is there another one?
I think lack of forgiveness is huge.
It's huge, yeah.
It's huge. I mean, I could sit here and talk about like the 6 different ones. But at the same time,
that's the big one.
The #1 is lack of forgiveness. And I can guarantee you, looking at everyone with autoimmune disease, if you actually have this conversation, 95% of them, if they were honest and they did the work with us, they would really quickly realize, I have a hard time with forgiveness.
What about loving themselves?
Well, that's part of it. How can you love yourself if you don't forgive yourself?
Yeah, that's true. That's true. And now, how did you come to this, though? How did you figure this out? I mean, like I said, I understand the medical stuff because you're a medical doctor. But how did you figure out the spiritual part?
Because of my own lack of ability to make a breakthrough until I did.
Well, what triggered this in you? What triggered it? Something had to happen.
Well, there were many things. I mean, so for me, my mom died. And she was a, I would say classic Asian judgmental mom, right? And there was a lot of lack of forgiveness that was going on, a lot of anger that I had.
You were angry at her?
I was very angry at her, and I was angry at myself.
For being angry at her, because you can't be angry at your mom,
absolutely.
right?
How can you be angry at your mom? So it's like this whole thing, and yet your mom's kind of pissed at you all the time anyway.
Yeah.
But for me, when my mom passed away about 5 years ago, she came down with Lou Gehrig's, ALS. Yeah, and we're learning more and more now that's actually autoimmune. Okay, really? There's actually an autoimmune. It's a mystery illness. People don't know why.
She was carrying a lot of stuff with her too.
Well, I have autoimmune disease. This is genetic. So of course my mom would probably have an autoimmune disease.
Exactly, yeah.
But it was really interesting was that throughout that process towards the 18 months from diagnosis to death, I really had to work through that forgiveness piece. Because it was the last 18 months I would have to spend with my mother.
Yeah, and you can't let her leave this planet, I mean, feeling that you hate her or mad at her.
And if I can't forgive myself, I couldn't actually open myself to receiving her love either.
Yeah, that's true, yeah.
I was busy being angry.
Yeah.
Right?
Yeah.
So when I actually was able to forgive myself and forgive her, it was a huge breakthrough, not just in my health, but it was in my business, in my relationships, in my personal life. There was huge aha and big metamorphic changes that happened.
Look at the things that happened to you to bring you to this point. Lose your mother, you had to get sick at a young age. It's amazing, but a lot of people wouldn't learn from this, but you did. And you not only learned, but you're helping other people.
This is I really feel like my actual superpower is not as an MD. Yes, thank goodness I had the training as an MD.
Yes, you needed to get to this point.
But my actual superpower is that I have a very intuitive sense of what people need spiritually, even if they don't know it themselves.
Have you always had that?
Yes.
Where's it come from?
I don't know. I get it from my mom, maybe.
It's good, yeah.
You know, but that sense of intuitiveness about, so I would have a patient in front of me, and it was something I recognized like fairly early in my career. They may say they have heartburn, but I know there's something else going on, and I could tell within the first 3-4 minutes that what is the actual spiritual state underneath that's triggering it.
Was this before you had your auto?
Yeah.
Oh, wow.
Yeah.
So you were kind of ready to do this thing, I think.
I don't know why, but I'm just more in tune with people spiritually.
Yeah.
It's like I see it. You know, I'm not even looking for it, but I see it.
Yeah, well, that's a great thing, I think.
Like I'm not going to go right now, but I can already tell you later on off camera, like what is your deepest desire that you actually really need.
Oh, I don't care if you
and I could tell that within I could tell that within like the first minute of meeting someone. What is their like deepest desire?
That's okay. Robert told me things on camera. Oh, you interviewed another person.
I'll hold it up. I'll hold it up.
Not that I want to be a straight. Maybe we better not go there.
But I think we all operate from that. Like we have a deepest desire, and that's actually where.
Whether we know it or not?
Whether we know it or not. Most of the time people don't know it until they actually do some of this work, which is why I love working on that in our program. Once you realize what the deepest desire is, you realize why your values are where they're at. And what I love working with people is actually also helping them shift the values to what they want to manifest moving forward. So you can't get better in autoimmune disease if you don't actually look at your own internal spiritual state, what the values that are guiding those decisions are, and then make some growth changes to change how the hierarchy of your values are so you can manifest a different future.
Absolutely.
So this is exactly what I did for myself, and then I don't know any other way to operate medically with people except to do all this with people. And that's why they get crazy ass results that they can't get just going to their doctor.
Well, because doctors are, excuse me if I'm wrong, but they're just body. We're body, mind, and spirit.
Yes.
How can you heal unless you heal your mind and your spirit as well as your body?
But I think, Pauline, is because they haven't experienced this themselves. When you've experienced the depth of suffering of cancer, chronic disease, or autoimmune disease, and you actually fought and won your way out of it, and you gain these incredible, powerful lessons that change your life, and you become a teacher with that, then I think it becomes so much more impactful. So it's not for a lack of good intentions.
No.
Right? But to have gone through that and to come out the other end, I think is why I'm a good teacher, why I enjoy this.
Absolutely.
Right?
Yeah. And you had that spiritual bent to begin with, obviously. Yeah. So tell us a little bit more about your training online, and you said all over the world too.
Yeah, so what we do is we actually have an 8-week online program to actually help teach people how to turn around their autoimmune disease. We do testing for people's hormones, their adrenals, their food mapping testing.
Do you have a lab or something where you do all
Yeah, we work with labs, and we have clients, and we can ship test kits to them, so that there's data. You have to have data. So I'm an MD, so I'm a scientist too. So I love geeking out.
MD.
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 Yeah.
Yeah.
So I love
maybe you have an extra degree there.
I love providing people the data they actually need, not on the 10,000 other crap they don't even need that people try to sell to them. So what is the actual data that you really need? We provide that in the program. Number two, we do an educational model. We actually teach parents, kids, people how to actually use this data, how it fits all together to stop feeding the autoimmune attack. And we mesh it up and add powerful mindset work and spiritual work in a community setting, in a small group setting. So it makes us so much more powerful.
Would this be good for somebody who doesn't have an autoimmune disease right now, but just to prevent it?
And the answer is hell yes. And the interesting thing is hell yes.
I love it.
but the reason is, but truly, a lot of times people don't have the leverage to do a program like this until there's really a big pain point.
Right.
What I find is that
well, unless a family or a friend has it, maybe.
Yeah, but for me, like people with there's so many diseases people don't even realize is autoimmune. So one of the biggest diagnoses that's like a basket trash term is fibromyalgia.
Oh, yeah, let's talk about what are some of the...
Well, there is no blood test for fibromyalgia. Yeah. There is no blood test for irritable bowel syndrome. It's in the absence of testing, you have a bunch of symptoms, they give you this trash term diagnosis. But really what it is autoimmune disease that people haven't been able to diagnose because the blood test doesn't even exist.
Parkinson's?
What they're finding more and more, and even Parkinson's has a big autoimmune component. So that's what I'm saying. So many, what we're finding that is that science is slowly catching up to actually show people that there's actually a huge autoimmune component to many different disease states that we're dealing with. Yes. Well, cancer is really interesting because your immune system not only protects you from germs, it's actually preventing you from cancer also. So what we find is when we have medicines or drugs, a lot of drugs and medicines used to deal with autoimmune disease is to say, let's shut off the immune system. But what's the number one side effect of those medications when you shut off the immune system?
You can get cancer.
Two things, life-threatening infection and cancer. So cancer risk is huge, the biggest drugs for autoimmune disease, because why? You shut off the immune system. Oh, it deals with this autoimmune attack. Oh, 2 years later you get cancer. Because your immune system is shut off.
I just, oh gee.
Right?
Yeah, you can't shut off your immune system. If anything, we should be building up our immune system.
Exactly. I tell people that what we do is teach your immune system to work for you instead of against you.
Exactly, and that's part of your program.
Yes.
Oh, that's great.
So this is all about understanding the bigger picture of how these pieces fit together. So it's not just about, I have rheumatoid arthritis and that's it. It doesn't sit in isolation.
Arthritis is another autoimmune.
It can be, yes. But what I'm saying is it doesn't sit in isolation, the medical diagnosis. It's in congruence with, where your emotional state is, where your heart is, how your lifestyle is, and the family history and the environmental toxins and exposures. And there's so many pieces of this, people cannot possibly put it together themselves. Doctors have zero training in this.
So I was thinking, is any one of those components more powerful than the other? Like with the spiritual, if you worked on your spiritual, could you, align yourself?
To me, the spiritual mindset component is the most important piece.
That's what I was thinking.
No one coming into the program tells me that's the piece they need. Zero people coming in.
Just maybe because I do this kind of work, I would focus myself on my spiritual thing first.
You're the rarity. Okay, so literally 99% of people come in because they have a huge medical symptom or pain point, and they have to deal with that, and they come in because I'm the MD, and they said, oh, this is the big educational program, and I tell them it's a big mindset spirituality program also, because that's why we're so successful. We have turnarounds that's unheard of. I mean, literally looks like miracles, but it's not when you actually address the whole person, right? But it's interesting, they come in thinking it's all about the medical pieces. Every single interview I do a live interview with one of our clients every single week. And every single one in the interviews will tell you, when I say, what's the linchpin, what's the most important thing? I would say 80 to 90% of them will say, it's changing the pattern of my thoughts, changing my energy. That is what created these outcomes and sustain the outcomes. We've had interviews with alumni who's like a year out, longer out, and they say the same thing. What has kept me well is actually the spiritual changes and the alignment that I made in my body and my mind.
I never would have thought of that in the beginning.
They never do, but it's okay.
Without giving a name or giving away anything personal, tell us just one little story about one patient that was really bad and could just give us a little story about.
So I have Kim, and she wouldn't mind me mentioning it, Kim Kaiser, and she actually did an interview with us, and she came in without a diagnosis with decades of suffering, right? And she lost trust in all the doctors, all her own research, and even in herself, because everyone's labeling her as crazy, and she had all these symptoms, right? And I remember just being on the call when her and her husband were thinking about enrolling in the program, because this is a big program. It's a big process they're going to go through together. And I remember that she didn't feel like she was worth it.
Oh, God, there you go right there. Well, I want to ask you a quick question. When doctors can't find the reasons, they think it's in your mind, right?
Well, frequently autoimmune disease patients are labeled as crazy.
Yeah.
So that was her, and that's typical. And she thought she was crazy, and she didn't think she was worth it.
Well, that's a bad part. That is the component there.
But you know what I love is that the people we choose our clients. We don't take, we take 10% of people who are interested in joining our program. We only take 10% of them.
Is that because you can't treat all those other people? Or?
Well, it's a huge investment of our time, energy. And the other thing is, how many people do you think are right to actually do this type of work? Are actually open to do this kind of work?
But if I saw the results you were getting, well, of course, like you said, I'm a little different. I would jump right on the bandwagon there.
You would, but you're also in a state where when I explain that this is you have to be willing to change your mindset, your thoughts, and your spiritual alignment. Not everyone's ready to do that. Right? So we choose the clients that we work with, and that's part of the intuitiveness of it. It's really important for us to have a filtering process to make sure the right people get in, because it is a small group environment.
And Kim was one of them. What happened with Kim?
What happened with Kim was she had complete turnaround by like week 6.
Wow.
Because what happened was, I remember even the first couple calls, she was talking about how she couldn't either get off coffee or donuts, or, I mean, she looked like broken. And it was, and she was spinning with anxiety. Right? And finally, I said to her, cause and effect is the most important thing that we do. I said, Kim, you've been labeled as being crazy and having anxiety your entire life, right? And she's like, yeah. And I go, you feel that way right now, right? Yes. And I asked her, what did you have for breakfast? What didn't you have for breakfast? And then I showed her that basically she was having hypoglycemia, low blood sugar, over and over again, which is an epidemic in people with autoimmune disease. She doesn't have anxiety. She has recurrent low blood sugar over and over again. And it was like this huge aha moment. And her physical state was affecting her identity of self, her spirituality, and her sense that she was just losing control of everything. That when the light dawned and clicked in that it was low blood sugar tied with her anxiety, she was able to fix it within 48 hours.
Amazing.
And on the next call, which is a week later, she was like, Maggie!
That's wonderful. Don't you feel good you can help these people?
Well, but it's just, that's the self-realization part that I love helping people with. And that's the part when I'm saying it's the intuitiveness. As this person is spinning in front of you and like going off, you literally like, stop.
That's wonderful.
Kim, stop. She's lost a ton of weight. She's literally radiant. Her husband, Nick, is like, thank you for giving me my wife back. Her kids are thrilled. And she's just a light, and she's really active in our Facebook group, which is Transform Autoimmune Disease Naturally. And a lot of people have questions and are hopeless. She's constantly chiming in and just giving and giving and giving.
That is wonderful. What you're doing is just, I don't know, it's so amazing. What's the best way to reach? Oh, go ahead.
And Kim does not have fibromyalgia. Kim doesn't even have a diagnosis.
Yeah.
She doesn't have a diagnosis.
We don't know what she had. It was just her.
And you know what? She's never going to get one, not on her watch, not on my watch, not on Nick's watch.
She doesn't need it.
She doesn't need it. She's going to prevent it.
Yeah, that's wonderful.
Yes.
That's wonderful. Anything else before I ask you the best way to get a hold? Because if I had this problem, I'd definitely be calling you the next day.
Our website is drmaggieyu.com. They just go there and you could watch our free training and we get on the phone with a real live person with us.
Wonderful.
Because a huge part of for me is this isn't about a transaction, this is a connection. And a connection really starts with a phone call and a conversation.
And you're helping people all over the country and all over the world too?
We have Australian clients, Canada and the UK.
Okay.
Yeah. Because it all can be done online.
That's amazing.
Yeah.
I believe in online. That's great. Anything else you want to add? This is just...
No, this is a kick in the pants, Pauline. This is great. Yeah.
I love you for what you're doing. I really do. I mean, I could cry now. It makes me so happy you're helping people. I don't know if I can finish the show. But thank you so much. I think that's wonderful.
You're welcome. Thanks for inviting me on. This is wonderful.
You're welcome. Thank you for watching. And excuse me, I am a little emotional because I think what Dr. Maggie is doing is terrific and she's helping so many people. So if you have any questions, you'll get all the information. Don't worry. So thank you for watching another edition of Pauline Interviews.